Mood can be defined as a pervasive and sustained emotion or feeling tone that influence a person's behavior. Disorders of mood, or in simpler terms, variation in experiencing this mood, form the cluster of disorder of mood. Depression is a class of disorder that belong to this larger category of mood or affective disorder. If only depression or only mania occurred in an individual with an affective disorder, the disorder is described as unipolar. If both occur, the disorder is described as bipolar. Other than these, three additional forms are dysthymia, cyclothymia, and seasonal affective disorders. Now, as you have already studied about the types and the clinical picture of these in details, in this lecture we will be focusing on its etiological factors only. So, we are not going deep into these types or its clinical features. We are going straight into the etiological factors. So, coming to the etiology, it is difficult to establish the etiological factors for the depressive disorders since there is a wide variations in the patient population. However, attempts have been made to find out the causative factors belonging to the different domains, visibly biological, genetic, and psychological, though there is a considerable interaction among all these domains. So, we will be starting with the biological perspective. Biochemical theories suggest that clinical manifestations of depressive disorders mediate through changes in brain neurochemistry. Biochemical investigation in depressed patients have focused on the monoamine neurotransmitters because monoamine pathways appear to play an important role in the actions of effective antidepressant drugs. The monoamine hypothesis suggests that the depressive disorder is due to an abnormality in an monoamine neurotransmitter systems at one or more sites in the brain. 3 monoamine transmitters have been implicated: 5-hydroxytryptamine, noradrenaline, and dopamine. An important theory of biochemical research has shown the importance of neurotransmitters norepinephrine and serotonin in depressive disorder. According to this catecholamine hypothesis, decreased level of norepinephrine produce depression. The findings obtained from the PET scans show that the brains of depressive patients have a reduced responsive to serotonin. Now, this is from the work done by Mann et al. In 1996. Another biochemical theory indicates the importance of hypothalamus in the causation of depressive disorders. The findings show that depression is due to the malfunction of the hypothalamus. The hypothalamus affects not only the mood but many other functions that are typically disrupted in the course of depression, such as appetite, sexual interest, etc. etc. The hypothalamus regulates the pituitary gland, and both the hypothalamus and pituitary control the production of hormone by the gonads and adrenal and thyroid glands. So, there is substantial evidence that in depressive disorders there is some irregularity in this process, and as a result the depressed ones often show abnormal hormone levels with enlarged pituitary and adrenal glands. Hormonal imbalances caused by the hypothalamic malfunction appear to be particular characteristics of the endogenous and psychotic depressions. So, these are the biological factors. Now, we will be talking about the genetic factors. For the genetic data, they strongly indicate a significant role of the genetic factors in the development of the depressive disorder. So obvious. So by this we'll be talking about the family studies that show that the first degree relative of people with the major depressive disorders are much more likely than other people to develop these disorders. For major depression, their risk is 2 to 3 times higher, and for the bipolar disorder, it is 10 times higher than that of the general population. The most impressive evidence for the hereditary factor or the heritability of the mood disorder come from the adoption studies. In a study of the biological and adoptive parents of bipolar patients, as it was compared with that of the biological ones and the adoptive parents of the normal adoptees, it was found that 31% prevalence of the mood disorders in the biological parents of the bipolar adoptees as opposed to the 2% in the biological parents of the normal adopters. This finding and other adoption studies also. Now this study was done by Mendelwiz and Reiner. Now this, and in addition to this, other studies also, they actually have a support for this study that say that a genetic component in both bipolar and unipolar mood disorder was strongly found in their studies. An important new direction in the genetic study of mood disorder is the linkage analysis studies. Now, in this, the investigators, when compared the chromosomes of the family members diagnosed as suffering from bipolar disorders with those of the members considered psychiatrically well, they consistently found a difference in the chromosomes. So, linkage studies means the lineage in the chromosomal patterns. However, other studies in this area have found mixed results. Some of the studies have failed to show any linkage between the bipolar disorders and the markers on the chromosomes. However, some show linkage to genes. These divergent findings, however, are viewed as an indication that bipolar disorder is not a single disease but a group of related diseases with a variety of genetic causes. So, it can be genetically also, we can predict the causation of depressive disorders. Now we are coming to the psychodynamic perspective. The psychodynamic theorists, beginning with Freud, traced depression to an early trauma that is reactivated by a recent loss, bringing back infantile feelings of powerlessness. Some theorists view depressives as love addicts who attempt to compensate for their low self-esteem by seeking reassurance from others. This viewpoint was shared by Fenikel in 1945. But dependency on a loved one can turn to anger and guilt also. So empirical studies lend support to the association of depression with dependency and with early loss of a parent or poor parenting. Now we'll move on to the cognitive perspective of depression. Now, depression involves a number of changes, emotional, motivational, cognitive and physical. Cognitive theorists hold that the criteria that the critical variable is the cognitive change. In all cognitive formulations, it is the way people think about themselves, the world and the future that gives rise to other factors involved in the depression. The cognitive perspective has two main theories of depression. One theory focuses on the learned helplessness, that is the belief that one cannot control or avoid aversion events, combined with helplessness, that is the feeling that negative events will continue and even increase. That means it is a sort of learned helplessness. It's like a kind of a mindset, a belief system that nothing can be done, nothing positive can be done, and no help or nothing can actually help the situation or help me. So that is learned helplessness. And the second cognitive theory traces depression to the negative schema or images of the self, the world and the future. According to this theory, the negative bias, the tendency to see oneself as a loser, is the fundamental cause of depression. So in this case, in case of this negative schema, everything I attribute to be negative. That is, it is a negative self-image about the self. When I'm talking about self, how I see myself, how I believe I work, how I believe or how much I believe on my worth. So everything that is negative. So I have a negative self-image, and how I view the world, that is also negative. This world is a negative place, it gives me negative vibes, everything bad will happen to me. So that is, I am viewing the world as a negative place. And about the future, I am never hopeful about the future, I am always pessimistic. What will happen will be bad only, I will have a bad future. So I have actually a negative schema or negative image or negative concept about the self, the world and the future. In addition to this, some life events and environmental stress, these can also act as factors of for producing the depressive disorders. Now, relating to this, one long-standing clinical observation is that the stressful life events more often precede the first episodes of mood disorders than the subsequent episodes. This association has been reported for both major depressive disorders and bipolar 1 patients. It is also evident from many studies that the poor social support, measured as a lack of intimacy or social integration, is associated with an increased risk of depression. I'm talking about the life events and environmental stress. So as we can see, if I'm it's like if I don't have that kind of social support, or I don't feel I have that much of intimacy that I can share my problems, and if everything, actually all the domains are so interlinked with each other. So if I have this negative view about the world and about self also, okay, I can't trust anyone and I can't build up intimate bonds with anyone, obviously I'll lack a support system, and in times of crisis I might succumb to that. So this is all, and in some it may be stated that the depressive disorders are due to a complex interaction of genetic, neurophysiological, biochemical, developmental, cognitive and situational variables. So all the variables, see, all these variables or all these factors, they do not function in a discrete way, they are all actually related to one another. So when we study it, we should see it in a wholesome way, in a gestalt way, so that we can see how these factors are interrelated to each other and cause the depression or the depressive disorders. So this is the etiological factors. If you have any doubts regarding this, you can obviously reach out to me, and we will be discussing it in our doubt clearing class. Okay, thank you class.